Time now for this week's Health Matters. Paul Critz with you, along with PA Lynn Szabo. And Lynn, how you doing today?
I'm doing okay.
You all right?
Kind of batting down the hatches, waiting for the weather to roll in.
Looking out the window, it looks like it's mostly here already, but it's going to stay for a while this week. Yeah, oh my gosh.
Yeah.
Well, I don't know if that has anything to do with today's topic at all, but today we're discussing Parkinson's disease.
You know, I know a couple people up here who have it, who are not in my patient realm, but in my friend realm. And I have family members that have had it. So I suppose one always worries that it's genetic. It's not really.
Okay.
So I decided to learn more about it, and I found some interesting factoids.
You know, despite all the high-profile people who have had Parkinson's in the public arena, I know nothing about it. So I'm looking forward to this. Yeah.
And it's pretty common here for interesting reasons.
Okay.
So what it is, Parkinson's disease is a chronic progressive neurodegenerative disease. So neurodegenerative disease, where the main problem is what they call bradykinesia, which means slow movement or problems with movement. So typically, we all know about the tremor, okay? And there's another kind of tremor called an essential tremor, where when somebody tries to do things, then they get the tremor. This is opposite of that. It's a resting tremor. So really common in the hands, really common in between the thumb and the first finger, often called a pill rolling tremor, because it looks like somebody's rolling a little pill.
No. I've seen that hand motion,
Yeah. But also with rigidity of movement and other kind of ancillary problems. So this becomes a problem with people walking because they take their balances off first thing when they go from sitting to standing. So any positional change like that, they take short shuffling steps and they kind of are hunched over. And it's actually, when they look at you, it's kind of like they're looking up with a neck that's bent down. So they've got a particular expressionless face. And oftentimes those are the kind of symptoms that people pick up first before they pick up on the tremor.
Okay.
Yeah, kind of interesting.
Huh.
Also with non-motor symptoms like constipation in women, urge incontinence, so urinary incontinence. A lot of women in my age group have urinary incontinence, so that might get blown off initially as too many babies, but it's actually an early sign of Parkinson's.
Wow, okay.
Yeah.
Okay. Is there a way to tell when these early signs can be differentiated from other things that just might be happening, like you say?
Totally, by paying attention and acting on them. So that's the reason for the talk, I guess. So it's a clinical diagnosis. Most internists could make it. I think actually even on the family practice, and maybe non-physician providers could at least get an idea about it. But oftentimes the diagnosis happens at the level of the neurologist, which we don't have in here in this county anymore, although there's a single practice in Humboldt County.
Wow.
Most people go to Medford where they seem to be more plentiful, if insurance allows it. So it's a clinical diagnosis, so you're not ever going to get the Parkinson's test that's going to tell you that you have it or not. It's going to be somebody kind of interviewing you, maybe over the course of 20 minutes, doing a couple of bedside maneuvers and then coming to the diagnosis.
Wow, that's interesting. Why is that?
Because they haven't found a way to do testing yet, except for, I suppose, the few families that seem to have a genetic issue. They probably get gene testing and stuff. But what that leads me to believe is that it's not really a singular disease as much as a syndrome.
Sure.
So a lot of different factors come together to cause somebody to have this neurotransmitter problem and then have actually disease expressed.
Right. There is no magic bullet. There's a lot of them.
Right.
Yeah.
So it comes from a lot of different directions. And unfortunately is incurable, but it's treatable, and the goal is to improve quality of life. So the references that I was listening to said to jump on the diagnosis early, because you can really help people cope with an advancing disease, and then also anticipate what problems they're going to have down the road and address them before they're catastrophic.
Okay.
So, oftentimes we talk about, old deceased, usually white male doctors who lend their names to stuff. So instead of mocking the system, I decided to see who Parkinson was. So James Parkinson was alive in the early 1800s, mostly late 1700s. He was a physician and a surgeon. So there's, at that time, and probably even kind of today, there's a distinction there.
How do you mean?
So he was a doctor who practiced medicine, but also somebody who was able to do surgery.
Wow, okay.
He was also a paleontologist, as a throwaway fact. But so kind of a Renaissance guy.
No, and the little factoid you have here is really interesting.
Yeah, he was
to
the
me.
first person to recognize a ruptured appendix was a cause of death.
Wow.
So I imagine he did a lot of anatomical studies on cadavers and stuff.
Yeah.
So, so that's who he is, and he described what I think is a syndrome. So he got the disease named after him, I guess. So, but here's the trip. This is what I thought was interesting because I've only really known very few men that had it. But Parkinson's disease is more common in white men, and there's regional evidence of the disease. So some people living in certain parts of the world have it more often than people living in other parts of the world.
Any idea about commonalities between those locations?
Yeah, rural, well water,
Okay.
pesticide and herbicide exposure,
Seriously, so this is a modern disease?
kinda,
Yeah.
and kind of mind blown, pulp mills.
Oh, damn.
Oh my God. Who does that sound like?
Just damn near everybody I know. And if we were on well water right here, we'd fit the bill. Well, I guess the pulp mill is long gone now up the road, but it was here for a lot of
Yeah,
years.
but it has a lot left
leaves
to us.
a lot
probably.
around. Yeah, exactly. Yeah.
So what it starts with is a genetic disposition. So you've got in your genetic makeup, apparently you have a weakness toward this, okay?
Wow.
A possibility of this happening. And then you get an environmental trigger, which is what I just said, rural life, well water, pesticides, herbicides, and pulp mills.
I'll be damned.
Yeah, it would be interesting. I don't think the numbers are enough, but you remember that pulp mill in Humboldt County out kind of on that that western side of town there?
The western side of town.
Yeah. Anyway, it'd be interesting to see kind of what things are like downriver from that.
I can't even place that in Eureka. The western side of town is the Pacific Ocean. I don't know
well, almost. So what I'm talking about is after when you're driving south on 101 and it takes that abrupt 90-degree turn. And so after that, it used to be a side of town that smelled like pulp mills, kind of smelled like rotting sauerkraut.
Oh, yeah. It smells like a fart in a paper bag.
Exactly.
Yes.
And I coincidentally, I don't know what I could make of this, but saw a lot of kids with asthma who developed asthma kind of on that part of town.
Wow.
And so I don't know the etiology, but it made me think about wondering what that was doing to the environment.
Yeah.
So now that we're a couple decades down the road from that, is there, if you could look at Eureka, it's probably not enough numbers. Was there more likely if somebody grew up in that part of town that they might be suffering from Parkinson's?
I'd be interested to see something even like a regional map about just kind of the northwest of California up here compared to the rest of it.
Yeah, totally. And then the other thing they said is it's super uncommon in like Africa and Asia.
Really?
Yeah. So I imagine not as many herbicides or pesticides.
Or is the genetic proclivity that much more pronounced in say Europeans?
Data-free zone.
Yeah.
Yeah. So kind of interesting.
Huh.
And so the main cause of the bradykinesia or the problems with movement are due to basal ganglion dysfunction and dopamine deficiency. So dopamine is a neurotransmitter. So the brain and the nerves can't send messages to muscles to make movement that is without effort. There's a hang up in the communication system there.
Right.
And I kind of spent the morning reading about what the hang up was, and it's super complex. So again, making me think that this is actually a syndrome with multiple causes.
What's basal ganglia?
So those are nerve cells in the brain, and basal identifies where they're located. Okay. So in the basal part of the brain. So the most common treatment was a drug that used to be called Cinemet, no longer manufactured, I guess, because they had problems getting supply. However, it is available in kind of a generic form that's identified as carbidopa levodopa, so it's a combination drug. Mm-hmm. And it specifically functions as a dopamine agonist.
Okay, so am I reading agonist wrong? Isn't that an inhibitor of some kind?
Yeah, what it inhibits is the destruction of the dopamine.
Okay. It's just gotcha.
Right. So you've got not enough dopamine being produced, and you could address that either by a drug that increases dopamine, but that's not really a choice here because there is no increasing the dopamine. The cells that make it are kind of kaput.
It's just about regulating its reuptake, right?
Yeah, exactly, or its destruction.
Mm-hmm, okay.
And then sending it, there's also drugs that kind of send it to the places where it can work the best. Mm-hmm. So they facilitate the best use of it. Does that make sense?
The best use of what? The dopamine?
Of the dopamine.
Okay, gotcha. Oh, okay. I see what you're saying. Sure.
So what we just said, drugs also inhibit dopamine breakdown. You could do deep brain stimulation.
What's that?
Scary.
Yeah, it sounds like.
It's where they put electrodes in the brain that fire off, and they kind of they're trying to stimulate these dying cells to work better.
Oh, wow.
Obviously comes with a lot of risk. Uh-huh. Brain surgery, kind of a big deal. The other thing is, pretty much you have these stimulators in your brain, so ongoing for a period of time. So I imagine at minimum there's like infection problems.
Oh, wow, because you're walking around with something in your brain, or you're not walking around with something.
Right, and you're talking about basal part of the brain, so...
It's deep, right?
Yeah, I wonder if they ever accidentally pith somebody.
Oh, no. Oops. Oh, problem solved. Yeah. Oh, wow.
And then you could also hypothetically get surgery done to take out the brain tissue that's actually causing the problem.
You say hypothetically, is that something that's been done?
Yeah.
Oh, no.
I can't imagine that somebody must have been desperate.
Because it sounds like what you've just described, the last two things are a very highly specific shock therapy. And a highly specific lobotomy.
Right, exactly, right? But not your frontal lobe. It would be more basal.
Okay.
But you still use that basal stuff for important things like breathing and heart beating.
Wow.
And so to me, that's kind of terrifying.
How effective is the drug treatment? And I'm sorry, the child you hear screaming, don't be alarmed. That's just a volunteer's kid here in the Fug House in the back there. He's perfectly fine. There, I just wanted to say that because I could hear him in the headphones.
His mom's attending to him.
Yes, exactly.
What was the question?
How effective are the
They're good, but they kind of wear off a little bit. So they're highly effective, and then the problem used to be that they would wear off after a while, and people would do drug holidays, which were very difficult on them.
Oh yeah, there's some drugs you can't do that with very easily. Yeah.
Right, and so that means you go from pretty acceptably functional, maybe not ideal, to like not functional, like bedbound and not able to move well.
Because if you need the medicine, then it's probably impacting your life already, just baseline, like very heavily, right?
Yeah.
And so taking the drug holiday puts you right back there.
Right. For a period of time, probably short. My guess is it would be like weeks to months. Mm-hmm. But still, I mean, who wants to live like that?
Yeah, wow.
And then, you take the med again and it works much better. So that's good. But not really,
Stop reading ahead.
Yeah, stop reading ahead. You found it. I gave you a little dog bone there. So the other thing, though, is that you can also, instead of just looking at, we must treat the disease, of course we must, but you can also treat things that are going to make people's lives miserable, like the constipation they kept talking about again and again and again. And constipation is not just like a momentary indigestion or something. It can lead to, like microperfs and obstructions and all kinds of terrible things. So even that kind of treatment can make somebody's life a lot better.
Right.
And the other thing with the incontinence, especially in women, is that I happen to have a friend who has Parkinson's, and this is a big deal for her, but she's not going to a neurologist for it. She's going to a gynecologist who is looking only at gynecologic reasons for it and not considering her underlying disorder. So that's kind of astounding to me. I think if somebody has Parkinson's, here's the take home. Go to a neurologist and tell them all the symptoms you have that are bugging you, not just the tremor, not just the problem walking, not just the standing up and feeling like you're going to pass out thing. Talk to them about all the things that make your life miserable. And there's ways around it. There's ways to treat it if the treating physician knows how much of a problem it is.
Okay, it seems like you contradicted yourself there in the last couple of minutes, and that in when talking about the constipation, you're like, there are things that you can that there are times to deal with the sort of atomistic sort of symptom of this syndrome, this one symptom that's making your life hell, whatever. Let's deal with that. Isn't that what your friend might be doing by going to a gynecologist to treat her specific symptoms?
Right. So I don't know if this answers your question, but medical specialties chop the body up and are interested in their medical specialty because they can do things about that. So this is like if the only tool you have is a hammer, everything looks like a nail.
Right.
So I don't think that a gynecologist would be able to understand the root causes if maybe he could be married to a neurologist. And
they just bring it up over dinner.
That could be what we talk about at dinner. But but I don't see it. I don't see that they're going to see it as anything but a gynecologic solution.
Whereas you might have a gynecologist treating something if they're doing it in kind of conjunction with a larger sort of Parkinson's sort of treat, or an eye toward the larger syndrome. That's
Exactly.
I get you.
Yeah. So if somebody is going to Medford to get treatment from a neurologist for Parkinson's disease, make sure that the things that are making your life miserable are known to them, because there totally might be a specific workaround that could be super helpful that other specialists are not going to see.
And it almost seems like
that's the point.
It might almost seem like that's, I don't know, maybe I'm misunderstanding what you're saying, but that often case is just kind of the default treatment for a syndrome like this. That we attack the symptoms, the myriad symptoms, because we really don't have an understanding about what's going on higher level.
Right. I mean, it kind of makes sense because, those particular bodily functions are overseen by the neurologic system, at least in some part.
Right.
So, but that's not as clear when you're in the exam room thinking about it. You're all excited about getting somebody on the right dose of neurological affecting medicines. So, anyway, so non-medical treatments. This was kind of interesting. So, good diet is important.
That's everything.
I think probably in this case, I could see an argument for an organic diet, although I didn't see that specifically.
So, because are the pesticides being consumed, or are they environmental because you live near where pesticides are used? Exactly.
Data-free.
Wow.
Yeah. So a good diet, if somebody's wondering about that, might be the Mediterranean diet, because there's a lot of fruits and vegetables. But I would think that somebody could reasonably be advised to go organic.
Right, or to avoid, just make sure you avoid as many pesticides as possible, if that's even a question.
Exactly.
Yeah.
And exercise, they talked about 3 hours of moderate exercise a week, and they specifically endorsed yoga. Yoga and walking on a treadmill.
Why?
Super
Why walking
specific.
on a treadmill?
Balance.
How? That's totally not how treadmills work. I don't get, that's the opposite of what I know about kinetics and moving and balance and using big muscle groups and things. Walking in 3 dimensions, walking out in space over uneven ground. The guy we had in here who was talking about walking barefoot everywhere said the same thing.
Yeah.
Walking on a treadmill is not the same, specifically for balance.
I think you could get around that by doing a treadmill program that was variable. So that kind of changed like abruptly. So like all of a sudden maybe there was an increasing incline, or there was a slow speed then a rapid speed to kind of mirror how we move in space normally. So I think
why not go move in space normally?
Well, that's what I would do. Because I'm not a big treadmill fan. But,
no,
but don't keep going on the same path around your block where it's flat and level and.
It's important to challenge. Don't hop on one foot around but it's important to challenge yourself and to move in 3 dimensions like that. Sure,
that's why I think yoga is important, and there's a lot of positions that kind of focus on balance in yoga, but in a lot of different directions.
Well, exactly? And what's the term? It's pro. Oh, for your awareness, your body awareness in space, and I forget what the term is, but that's a very big thing.
It's
I know
on the tip of my tongue.
Yeah, I know. And like for I know for autism it's a thing, and for it's a proprioception.
No, that's not the term.
That's not the term.
Proprioception.
Proprioception. That's it. Exactly.
Yeah.
Very good.
Yeah.
There you go. And because that's all yoga.
Right.
And that would be firing your basal ganglia.
And it's also easy to do. So if you're, let's say you're really affected by the symptoms of Parkinson's, then, you might automatically say, well, I can't do this, I can't do that. But you can do yoga sitting in a chair.
Right.
There's old people's yoga and, and gentle yoga. And, it's not necessarily designed to make you sweat. It's designed for you to be aware of your breathing, first and foremost, body position, second.
And control and body control and holds and things. Yeah,
totally.
That's very important.
And it's gentle. But here's the interesting fact.
And then when you're done with your treadmill walking, get yourself a cup of coffee and smoke.
Because rates of Parkinson's disease are less in people who drink coffee and people who smoke.
Why did I quit smoking? Now I'm going to get Parkinson's. Oh, man.
Yeah.
Wow. Okay. Well, I still have the coffee. I make up for it with the coffee. So there we go. Wow. So any sort of, how prevalent is Parkinson's? Was there a percentage you came across that you recall?
Yeah, I did, but it kind of depends on where you are. So I didn't see it as the best data, but it looked like 10 or less in 100,000 people years.
Oh wow,
okay. So it's got a time factor too. I have seen it more here, but I don't know if that's because I just hang out with older people who are developing it. But I have seen it more in men, which I wouldn't have expected until I researched this.
I only know of the 2 men I know who are big, who are celebrities with it, which was Michael J. Fox and Muhammad Ali.
Right. And so they also kind of lend support to my musing that this is a syndrome, because I think Muhammad Ali's disease problem was due to repeated head injury. And I think Michael J. Fox has an usually aggressive form of Parkinson's that is diagnosed early in life.
Wow.
So when most people get it when they're greater than 60. So age is the single most risk factor, most significant risk factor. But they do have it in kids.
Yeah.
Which is sad. And they do have it in young adults, like age 20 to 40. And so he has that variant of it, which makes me think, what was he, 27 or something?
Super young. I don't recall. Yeah, but super young.
Yeah. So, I think the disease that he has that looks to us like Parkinson's might be underlying different than we understand.
So, I don't know, this isn't a stupid question. Can you die from Parkinson's?
Yeah, people die. Yeah.
Is it a contributing factor? Is it not a head?
It's probably
like the
a contributing factor. You probably, lose your ability to swallow effectively and get pneumonia, I would guess. people's intellectual function definitely decreases over time.
Yeah.
And maybe they, I don't know, walk out in traffic or something.
I've seen there are videos. I believe it's Parkinson's they're talking about it, or maybe it's I don't know how similar in the very elderly, how similarly Parkinson's presents to like dementia and other things like that. But there have been videos I've seen, and this is just right up there with all of the worst anecdotal evidence you can come up with. But videos of people, specifically, there was an old man with Parkinson's who was just out of it, just not there, not present, and music. They started playing music for him, and it was like there was nothing wrong with him. It's something just cut through to his brain, and he was talking about the music and present, and it just accessed.
Is that while the music was playing?
Yes.
And did it when the music?
They said that it would last for a while afterwards.
Oh, okay.
Too. Yeah.
I actually was a nursing assistant for just a second, a long time ago, and there was a woman. I don't know. It's not known to me if she had Parkinson's, but she was pretty much in a convalescent hospital, not doing well, not able to move, not able to speak or anything. And I started speaking to her in Spanish, which was her native language, and she perked up. So yeah, I think you're able to tap into pathways that are really fundamental to who a person is, and then you're able to sneak by the diseased area.
And then that just begs the question: why do these diseases only? It seems so strange to us because the things that are affected in the brain are our personality. They are abstract things that we don't think about them as being physical things. And it's so strange to think of a disease affecting these abstract things, kind of hit or miss. Which parts of my personality does this disease attack because it's going after a specific part of the brain?
Right.
And it's why those parts as opposed to other parts? Why is it not just across the board? Why are you losing certain things and not everything sort of in total?
Right.
I don't know.
I think it's interesting to go from, look, we know this is a specific abnormality, and to see the expression in the totality of the body.
Right.
And how, really? Just that little thing?
Yeah.
Like, really? And then all of a sudden you start having all these other things happen. We are wondrously made.
Yeah.
So
yeah,
it's kind of amazing.
And it is. We're kind of like walking, breathing butterfly effects too. Just all
totally.
the little things that can happen inside
we're
us.
Kind of string theory, I guess.
Yeah, you're right. It's like we're barely here.
I know. Oh my God, it's so interesting.
Wow, that was very, very interesting. Thank you.
Yeah.
I know we talked about next week's. I hope next week's show comes off because I'm super excited.
I know, super excited about it too. So one of the main forms of exercise, especially during the winter up here, is our pool. And we have a remarkable pool.
Should be so proud as a community.
Remarkable standing O pool.
Yep.
So I happen to be working with a nurse who is the swim team coach.
That's awesome.
And we were at a conference seated next to each other, so he had me chattering the whole time. But he agreed to come on the show with maybe the captain of the swim team, who I understand is a really bright young woman.
The Sharks.
Yeah. And, and this particular nurse, and then somebody who's on the board, because changes are afoot and they're super exciting. So, the pool's going to shut down for some months. And they're anticipating even more months than they're confidently talking about now, because there's other things. Because they got a lot of money from the Son Caldwell Foundation.
Nice.
To upgrade. So they're upgrading the flooring and stuff. So that's the mundane maintenance. But they're gonna upgrade the quality of the pool with an electronic scoreboard and electronic touchpads, I guess, that when you're swimming.
So you can know how
you got like this really gee whiz way to get times down.
I've got questions about that, because how I guess you're gonna if you
we'll
come into
talk
competition, because their pool, it's not meters, so how sanctioned? It's 25 yards. It's so old.
It is meters. It's just weird meters.
It's not metric meters. Is that what
no? It's like it's
like 23 and a half
meters. But here's the cool thing about it. Apparently, and this is before my time, there was a big 4th of July extravaganza, kind of like the JC's basketball tournament, where people would come from out of the area and have a big swim meet, and they're going to bring that back.
Nice. That's good.
Super exciting. So they're going to talk about that.
And so they're closing over the winter. We'll be going up to Brookings and swimming. They have an outdoor pool, which will be interesting.
He'll talk about how that's going to be.
All right. Well, good.
Yeah.
So hopefully we'll be talking all things pool here. And everybody else listening, whether you're over in Klamath Falls or down in Eureka, you just have to sit back and envy us.
We'll just get something going in your neighborhood.
Yeah, there you go.
Yeah.
Lynn, thank you very much.
You're welcome.